We love you and we care about you, and we want to be there for you as a first responder in a time of crisis when there is nothing else to help. I'm Dianne Timmering. I'm Vice President of Spirituality for Signature Healthcare, based in Palm Beach Gardens, Florida. When I started about 3 years ago, we started with a small prayer chain in the company. We started with about 7 of us, and it grew and it grew, but one of the things that the prayer chain did, it started to inform us of all the need in the company, all the things that were happening to our people, health care issues, bills they weren't able to pay for example, significant surgeries, they just did not have the money to cover the surgery, catastrophic events, tornadoes, I'm about to say earthquakes, tornadoes, impacting our people and decimating their lives by just obliterating their homes, taking everything. We just had flooding, for example, in North Florida at Ormond Beach. Even though FEMA is going to come in and help them financially, there's that pocket of time where they did not know where to turn. We needed something else to actually, not just to pray, but we needed works. We needed action. We needed to be a first responder. We needed to be able to be there in the crisis mode beyond just the prayer. I mean, there's a scripture that says faith without works is dead. And we had the faith and we had the prayer, but we also needed the works.
Hi, my name is Susan Howery. I'm a charge nurse LPN at Westmoreland Care and Rehabilitation Center run by Signature Healthcare in Westmoreland, Tennessee. I've been with Signature Healthcare within the last 3, I've just started my 3rd year in February of this year. I've actually been with the facility on and off for about 12 years. On February 5th of 2008, an area in Macon County, Tennessee, Lafayette, which is where we live, was hit by an EF4 tornado about 10:20 on that evening. I was at my daughter's house babysitting my grandchildren. My husband and my son and his girlfriend were home. The tornado was a long path of destruction that did damage a lot of homes. I know it took, I think, 15 lives total in that area. And our home was pretty much a direct hit. It just completely obliterated our home from the face of the earth. My husband was actually trapped in the debris of our home and our neighbor's home, who had actually come down on top of ours. But by the grace of God, they survived and made it out of that alive. And then they actually came where I was, about 6 miles away, at about 11 o'clock at night, which I didn't expect them to be there. And initially when they came through the door, I asked them, I said, "What are you doing here?" And my husband threw his shoes down and he said, "That's all we have left." I said, "What are you talking about?" He said, "We've been hit by a tornado." And I was just in shock. I don't know how I reacted, but then he came walking toward me and I could see he'd been injured, and then I realized that exactly is what happened, and it looked like a bomb had gone off in our neighborhood.
Of course, the next morning we all come into the facility and we knew that a lot of our families and friends were affected by the tornado, so the facility come together as a whole to start taking up donations, clothes, money, food, whatever they needed.
There was a box taller than I could reach into in the administrator's office, who was Randy Ashby at that time, full of laundry soap and window cleaner, paper towels, toilet paper, baby diapers, baby wipes, hand sanitizer. I mean, you name it, it was in there. And they just said, "You get what you need."
That's just what we do here. We do that for anything, whether it's a tornado, whether it's a fire, whether somebody needs their light bill paid or whatever. That's just the way we are.
So when I came back to work, they had said on, and I can't remember what day it was, but Chris Cox, who is our regional administrator, he was here one day and they just said, "We're going to meet in the dining room at X whatever time it was, and Chris wants to speak to everybody." When we arrived in the dining room area, which is where we hold a lot of our meetings, Chris Cox announced that Signature Corporate had held a benefit luncheon because of our area being hit with the tornado and so many of our associates had been affected. I felt pretty overwhelmed, and I was overcome and pretty speechless, but very, very, very grateful.
It touches my heart deeply that we work for a company that is concerned for their stakeholders like that. I've worked other areas that would maybe say they're sorry or send a card, but they wouldn't have compassion that I feel like that our company has. And it just adds to that sense of family and well-being, and that there's a concern there.
What ran through my mind was that if the corporate people of Signature, if I ran into them on the street or in the grocery store, they probably wouldn't know who I was. So they got together and gave out of the goodness of their hearts to someone they didn't even know. It felt like, you know, you're here, you work for us, we want to help you, and that felt really good.
The real cool thing about the Compassion Fund is that not only can it assist all of our stakeholders, but it can also assist in all the communities that we serve. And being an administrator of a facility and being out there in the community and building on those relationships, it really should make every employee very proud of just the company they work for, and knowing that they have vested interest not in only just the internal, but also the external.
People believe in the good Lord above, or whatever they believe in angels, but there are angels on earth too.
Just take for example, $1 out of your paycheck each pay period. You'd come out to only providing $26 for the entire year. With 10,000 employees, you're looking at $250,000 that can go towards this Compassion Fund, and the impact that amount of money would have on communities, on employees, on families, loved ones, would be a great, great blessing.
The Compassion Fund extends to family members, not just stakeholders, but family members, and also outside into your community. Our communities are so important to us because we work with the local officials, the local government officials. We work with the local spiritual leaders. We are connected to your community. So naturally, it would be a part of the community in which you reside. The one thing I've found is that you all take care of your own. Our communities, our facilities take care of their own. So these dollars will be primarily apportioned to your events, the issues that happen to the situations that impact and affect your facility and your people and your family members and your communities. To be a recipient, a Signature employee or stakeholder, you must have been with the company for 90 days. For a family member or for someone in the community, they must live and work in that community to receive a benefit. Benefits are selected based on need. The financial amount is based on fund availability and also the measure of the catastrophe or the need. This is how it works. This is how you, the stakeholder, receives the benefit for something that is catastrophic or unexpected that happens to you, which of course we do not want that for any of you. It could also include a health issue. How you receive that benefit too is if that happens and there is no financial assistance otherwise to help you meet that need. We step in and provide you the compassion, the care, and the love to help meet that need. There is an application process which your administrator or your human resources director or your Compassion Fund coordinator will have available for you to either do for yourself, or someone of course can do it on your behalf.
My name is Annie Dickerson. I'm a restorative CNA at Signature Healthcare at College Park in Fort Myers, Florida. Well, I've been working in this building for 25 years. Well, I'm a mother of 5 children, one adopted son that's 6 years old, and I have 3 grands live with me, and my three of my own kids live with me. Just a big old happy family.
Well, it happened on December 22nd, so we all woke up that morning finding out via the newspaper, via phone calls, via coming here at work, that Annie's house had caught on fire the night before and had destroyed everything. And she had lost every single thing that her and the 8 people that she had living with her, family members, had. The only thing that they had was what was on their clothes, the clothes that was on their back when they got up out of bed that night, to be woken by Annie and the other family members of saying that the house was on fire.
Well, really, I don't know, because I was in my room in bed already, and I just heard my son-in-law run through the house yelling fire. And my only thought was just to try to get my kids out and grand. So after everything was over, they said it was electrical fire. They tried to save everything, but the fire had got up in the roof and everything. And it was metal or copper up there on the roof, so they had to tear that off, but they got it under control. It's around about 11:30. And American Red Cross came out. They put us up for the night.
Of course, we were all just completely dumbfounded and didn't know what to really do. It was a few days before Christmas, and Annie historically has always taken off a week or so before Christmas to do all of her Christmas shopping, because she saves up year-round in order to be able to go out and buy the Christmas presents for her family. So knowing that, we were also devastated by the fact that we knew she had just finished up that Christmas shopping and just had been placed underneath the tree, and here it's all gone, and they have nowhere to go, no house to hold a Christmas in for the children. So it was very, very disappointing, and we were very devastated as a family here at College Park. The moment that I realized that we had one of our stakeholders, one of our family members, going through a distressed time, I was able to quickly get on the email and get the prayer list out to we have a prayer list, an email list, that we can send prayers every day to ask for other people to pray for situations, for people, for facilities, for loved ones. And all of us came together, and emails, the response just was immediately from everybody from Kentucky to Tennessee to Florida, saying, we're there for you, we're starting up a collection right now, we're going to do a fundraiser, you're going to get a check in the mail on this Friday for Annie. We want to make sure that her grandkids and her children have something to open on Christmas Day, and they did make that happen.
We had people donating food, money, gift cards to different stores. We had people bringing in furniture, donating things from their own home, their new things, used things, and then we, every day for a couple weeks, we received items from other facilities. They were sending us checks and gift cards and things to pass on to Annie and her family also.
Toys and things for the kids for Christmas, money, coupon, gift certificate for different stores where I was able to buy the kids clothes and stuff like that. She brought me some food. But my administrator, she gave me a bed set, to try to help me furnish off my new place I got now. But people have been pretty good by helping me out.
When we all woke up and found out what had happened to Annie, it was a real in-our-face example of what we as a family of Signature can do for each other and what we do for our communities. And it's
extremely unique to have such a plan and a heart for the people in a huge corporation like this. Rare would be a better word for it. You just don't see it out there at all. In fact, when I was interviewing one of the ladies on the phone, at the end of our conversation, she said, "Could I pray with you?" And where does that happen in corporate America? It doesn't happen. And that excited me very much.
It felt great to be part of a company that cared that much for a stakeholder, a member of our family here at Signature.
Just as a chaplain and a minister throughout the years, you see a lot of people that do a lot of talking, and talk is cheap. It's exciting to see someone actually taking action to take action in these situations.
I'll sign up for the payroll deduction and be a part of it, and if there's a need here or in our community, I'd love to be part of the team that helps.
I just want to thank everyone for everything they've done for me and my family, and I really appreciate it.
This is how you can contribute for your facility, for your community, for your people. Voluntary payroll deductions. We will be submitting forms today for you to say, yes, I want to give 25 cents, $1. Give what you can. Give what feels right to your heart. Just do what you can. No more and no less. Back to faith and works. We will pray for you, but we will do more than just faith. We will just it's more than faith, it's more than prayer. It's works, it's applying, it's doing something to help you in this in-between time when in some cases you're having to rebuild your life. We love you and we care about you.